Good afternoon, and welcome to the Scottish Parliament's first ever Party Leaders Virtual Question Time. This is an unusual format for us, but these are unusual and uncertain times. Joining me today are the First Minister from St Andrew's House in Edinburgh, and from around the country, the leaders of our political parties. The leader of the Scottish Conservatives, Jackson Carlow, of Scottish Labour, Richard Leonard, the co-leader of the Scottish Greens, Patrick Harvie, and the leader of the Scottish Liberal Democrats, Willie Rennie. Now, before we turn to our first question, I'm going to ask the First Minister if she can bring us a brief statement updating us on COVID-19 and the government's response. First Minister.
Thank you, Presiding Officer, and thank you to the other party leaders. It's now exactly 100 days since the first cases of coronavirus were reported in Wuhan, and in that time our lives have been transformed in ways that would have been unimaginable just a few weeks ago. And this virtual session of FMQs might, in the scheme of things, be a relatively minor example of that, but it is a striking example for our Parliament. So I want to place on record my thanks to you, Presiding Officer, and all the Parliament staff for making this happen. I do want to give a very brief update on the latest figures we have in relation to COVID-19 in Scotland. As at 9 o'clock this morning, there have been 4,957 positive cases confirmed. That is an increase of 392 from the figures reported yesterday. As always, I should be clear that these figures will be an underestimate. A total of 1,781 patients are currently in hospitals across the country with confirmed or suspected COVID-19. That is an increase of 10 on the number reported yesterday, and a total of 212 people last night were in intensive care with confirmed or suspected cases of the virus. That is an increase of 2 from yesterday. And it is with great sadness that I must report an additional 81 deaths of patients who had tested positive for COVID-19. That takes the total number of deaths in Scotland where the individual had tested positive to 447. However, as you're aware, National Records of Scotland are now publishing weekly figures which will report on deaths where the virus is presumed as well as confirmed. And I want to convey my deepest sympathy to all those who've lost loved ones to the virus, and also say a heartfelt thank you to everyone working so hard to keep essential services running at this time of crisis. That, of course, includes our health and care staff, and I expect that all of us and thousands across the country will express our appreciation for them again tonight at 8 p.m. with applause. I know that opposition leaders will have questions on a range of matters on health and care services and on the wider economic and social impacts of COVID. But since we're about to enter the Easter weekend, I want to conclude with a strong re-emphasis of the vital importance of everyone following the public health restrictions that are in place and staying at home except for the permitted essential purposes. I know how hard it is for people to do that. It will seem even harder over this Easter holiday weekend, especially for families with children, indeed for the children themselves, and for older people who would normally be spending time with their grandchildren. So please stay in touch with family, friends and loved ones in whatever alternative way best works for you. Reach out to and look out for people even as you stay physically apart from them. But please do follow the rules and stay at home over Easter. By doing that, all of us can help to slow down the spread of this virus. We can help to protect our National Health Service, and we can also help to save lives. So I'll end by thanking everybody in advance for doing the right thing over this weekend.
Thank you very much, First Minister. We're going to turn now to questions. Question number 1 from Jackson Carlow.
Thank you, Presiding Officer. Presiding Officer, can I begin by expressing the heartfelt sympathies of all Scottish Conservatives for all those who've endured lost many families over the course of the last week. I also thank the First Minister and politicians from all across Scotland for their good wishes to the Prime Minister as he recovers from the virus himself. Boris, if you're watching, we're all urging you to get well soon and back into number 10. Presiding Officer, can I also applaud the virtual first that we're doing today and begin by asking the First Minister about personal protection equipment, or PPE as it's commonly called. Now, unions are saying the PPE guidelines are confusing. Frontline staff say the equipment isn't robust enough. Care homes say they don't get the kit until after the virus has actually entered a care home. And it emerged that the new PPE distribution hubs that the Scottish Government have set up may be shut at Easter. Now, for several weeks, we've been told that the supplies are adequate, that the problem is with distribution. And we all know this because we're all getting emails and calls from frontline staff and care homes. They've been told they've got the equipment, but obviously they're phoning us to tell us that's not the case. So, First Minister, at what point will you be able to say with absolute confidence that an effective distribution is in place for PPE? And if necessary, will you use logistics experts? I mean, many of them are currently doing nothing from the private sector, or even our armed forces if it becomes necessary, as they've helped elsewhere.
Well, thank you. Thank you for that question. I should say just at the start, we have Army logistics support based in this building in St Andrew's House already helping us with many of these issues, and I'm deeply grateful to them for that. So we will draw on support, logistics and otherwise when we need it, wherever we need it from. The issue of PPE is of fundamental, paramount importance, and we have been working hard to resolve the concerns that people have that roughly fall into the following categories. It's adequacy of supplies, distribution of those supplies to where they are needed, the guidance we're issuing to workers about what types of equipment they should be using in what circumstances, and also there have been concerns raised about the quality. So very briefly, we do have adequate supplies. We're not complacent about that. There are global pressures on that supply. We have taken significant steps to improve distribution, and we continue to do that, addressing glitches or concerns where they arise. And we commented yesterday at the briefing, Jean Freeman and I did, about working to make sure that distribution centres are open over the Easter weekend, just as GP practices and pharmacists will be. On the guidance, you may not have had an opportunity yet to see the joint statement that has issued this morning between the Scottish Government, COSLA and trade unions. We all took part in a meeting that was convened by the Deputy First Minister and the Health Secretary yesterday. That statement endorses the Four Nations guidance as being good quality guidance, but it also makes clear that wherever a health or care worker on the front line feels that they should be wearing a mask, they should do so. It is their professional judgment that should be the guiding factor, and the Scottish Government will continue to work hard to make sure adequate supplies get to the front line. On the issues of quality, there was a letter yesterday from medics. The Chief Medical Officer is engaging with the signatories of that letter. When the guidance that was issued last week was drawn up, there was input from experts from Royal Colleges, and there has also been health and safety executive input into the quality of PPE that is being provided. So, we treat these issues as hugely important, and on an ongoing basis we will continue to address any concerns that arise. There is of course an email address that anybody on the frontline workforce can use if they have concerns that they want to be immediately brought to the attention of me and ministers.
Jackson Carlow.
Yeah, well, I mean, of course, I accept that you will be taking these issues incredibly seriously, and I'm pleased that, that engagement is taking place. I'm pleased about the issues of quality. I'm pleased that centres will be open for the Easter weekend. But obviously, what I am concerned about is this ongoing issue with distribution, because so many people are still contacting directly to say they don't have it. And I'm not sure I did hear when you felt you would be confident that there would be a permanently successful distribution strategy in place. But I'd also just like, you'll come back to that, I know, but I'd like to raise the issue of shielding of vulnerable people. Because yesterday Sainsbury's said they were still waiting for a list of those who are vulnerable. And we were told last night by a council that they still don't know when food boxes will be delivered. Now, I accept that online delivery is not the only way to help vulnerable people. There are many who can't, though, get a slot for several weeks ahead where online delivery is available. And again, in Scotland, it seems that this has been rumbling on for weeks, whereas it is being resolved elsewhere. And I know people are getting frustrated, incredibly frustrated in my own constituency, and people who are emailing me from elsewhere in Scotland. So I can ask, when will it be fixed? When will supermarkets have the names of those who actually need to be supported and prioritised?
Well, let me come to that question in detail in a moment, but before I do, let me just briefly round off on the issue of PPE. You asked me when can I be confident. We have improved the distribution. We continue to improve the distribution. I think we do now have an effective distribution system in place. I'm not going to, though, predict that there will never be any glitches or there will never be problems that arise with that, such as the scale and magnitude of what we're trying to achieve here. So we will continue to have an approach where we quickly and I hope effectively resolve any issues in distribution that arise. But I do believe those systems are in place and in the main are working effectively. But we want to hear on an ongoing basis if anybody on the front line feels that they're not getting what they need. I've said before, and this will apply to all of us here, not just to me. I'm overseeing this coronavirus response as First Minister, but I've got family on the front line of the NHS. We all want these workers to have the protection that they deserve, and that's something I take hugely seriously. On shielding, let me just give a bit of an update. The shielded group, as we call them, are within certain medical groups that were carefully considered by medical professionals and experts. We originally said up to 200,000 people in Scotland would be in that group. We thought that would then be closer to 120,000. The figure that is the final one is 136,000. That's after some further discussions with doctors. They have all now had letters and they have been given a text message service to register with if they need help getting food or medicines. I can tell you as of now 21,000 of them have registered with that service. Just under 6,000 food packages have been ordered, and we have a national contract with 2 supermarkets in place for the delivery of those food boxes free of charge, I should say. And 4,200, I think that is, have already been delivered. So that process is underway. We're also working with supermarkets for people who want to get their deliveries via supermarkets of their own choice. And a text will go out to people who've registered from the service, I hope later today, asking them if they want their details passed to supermarkets. There will then be a priority service delivered by the supermarket, which we expect to be up and running in the early part of next week. So we've taken some time to make sure this is a system and a service that is reliable and robust. But I would stress that people do not have to rely on normal supermarket slots, because the national contract that is in place with breaks and bid food will mean that people get these food boxes delivered free of charge if they register for that service and ask for that service to be delivered to them.
Jackson Carlo.
Okay, I'm conscious of time, Presiding Officer, so I'll move swiftly on, but that was some very helpful information in there, First Minister, and I just hope that all of that can be put in place quickly. When grants were announced for business to get through these tough times, Fiona Hislop, your Cabinet Secretary for the Economy, told the Scottish Parliament March the 18th that they would be per property. And businesses were assured that every penny of support funding would be passed on, and they planned on that basis. But it then emerged that in Scotland alone, grants would only be on the basis of one per business, not one per business outlet. And that puts any firm in Scotland with more than one outlet at a huge disadvantage compared to those in England and Wales. First Minister, businesses in our high streets are dealing with the reality and not the theory of this crisis. And they're saying to us, they need this support if they're going to be there at the end of this crisis. They're asking me to ask you as First Minister to think again. Will the First Minister do so?
We are thinking carefully about the support we give to businesses, so every single penny of the consequential funding coming from the UK government is being passed on to businesses. We have designed this support in a way that allows more businesses to benefit. So by limiting the grant to one per business, we have enabled more businesses to benefit. So there are some properties, for example, with rateable values between 15 and 18,000 who get a grant in Scotland, who would not get that grant if they were in England. We've also given a range and providing a range of support that's available in Scotland but not elsewhere. So we're providing help for businesses who have difficulties with water charges. We've provided a financial support package for the bus industry. We've provided £5 million for the seafood sector. Another £10 million for the Seafood Billion Business Resilience. We've provided funding through Creative Scotland for artists and those in the creative sector. We are providing money for a range of sectors. that is support not available elsewhere. So every penny is being passed on, but we're trying to do that in as fair a way as possible, in a way that captures and provides assistance to as many businesses as possible. But I'm acutely aware, and this will be true in the UK as in Scotland, that there will be further support that businesses require in the period to come. So we continue to talk to business organisations, individual sectors and businesses about what more we can do to support them, and that conversation will continue.
Jackson Carlo.
Well, it's just that the Cabinet Secretary for the Economy told them that they could expect to receive parallel funding to that was going to be available in England and Wales. Many of them spoke to their banks on that basis. And the danger, if you've got 2 or 3 small outlets and you're only going to get support for one of them, is that the other 2 may no longer be open, and that could be a loss of jobs and viable businesses going forward. But finally, really just on the issue of the end of this crisis, everybody wants to know when it will end. We realise that the key thing is to flatten the curve, to reduce acute pressure on the NHS. And we know that for the moment, as you said in your statement, it's vital that all of us stay at home, all of us, protect the NHS and save lives. But people do want to look to the future as much as any of them can. And today's newspapers are full of reports that we might understandably living under the lockdown for some weeks yet. So, Presiding Officer, can I ask the First Minister to confirm that while this is first and foremost a public health decision, it is one that will be taken in lockstep as part of a 4-nation strategy across the UK, and that we can all hope as a country to come out of this together eventually?
First Minister.
I certainly hope the UK will be able to come out of these lockdown measures in an orderly way that protects health and is mindful of the other impacts in a unified way. Although we do, across the different parts of the UK, have to be mindful of the spread of the virus in the different nations and regions. I had a call this morning with the other First Ministers and the Mayor of London, where we were discussing our different experiences, and there's a meeting of COBRA later today. Let me be very clear. I don't want these measures to be in place for a single minute longer than they have to be. But equally, I don't want us to come out of them prematurely in a way that will do damage, that we see the virus spiral out of control, see our NHS potentially overwhelmed and see more lives lost. So it's right and proper that we stick with it for as long as necessary. And I want to be clear to people, because there's a lot of media speculation. There is no likelihood or prospect of these measures being lifted after the Easter weekend. COBRA is likely to meet again I think later next week. I would certainly support that, to start to think about the exit strategy and what that might look like. But it is likely that restrictions and measures are going to be in place for some weeks to come yet. And again, I would appeal to people to stick with this. We are not asking people to change their lives in such a fundamental way for no reason. I don't want to be doing it, but it is vital for the health reasons I think we all understand.
Thank you, colleagues. Now, I don't have my gavel to hand. It's difficult to make eye contact, but I would just ask you all to be conscious of the time. We're going to try and finish this whole session by 1 o'clock. Question number 2, Richard Leonard.
Thank you, Presiding Officer. And can I begin by offering the condolences of the Scottish Labour Party to all of those families who have lost loved ones over the course of the last few weeks, not least to the families of Catherine Sweeney and Janice Graham, 2 frontline workers in Scotland who have lost their lives to COVID-19 over the last few days. And we applaud the efforts of all of those frontline workers who are, in the end, saving lives and at times putting their own lives at risk in so doing. It's a national collective effort, but they are very much leading it, which is all the more reason why I do want to return to the issue that's arisen over the last few days around the guidance issued by the Chief Nursing Officer on personal protective equipment, which has caused a good deal of concern amongst people working on the front line, people who are already working in the community, providing home care or district nursing services, for example, already under pressure, put under even more stress and pressure. So my question is to the First Minister, can she give a categorical reassurance that those workers in the community on the front line will receive the personal protective equipment, the right and adequate personal protective equipment that they need?
Well, the issue Richard Leonard raises is an important one. It's the issue that was raised about the guidance is not so much about the supply of PPE, which we continue to work hard to maintain and distribute, although, as I said earlier on, there are pressures globally around these supplies, so there's no complacency there. This was an issue about the guidance and the interpretation of that guidance. In short, the Chief Nursing Officer's letter said, and it was intended to simply interpret and articulate the UK-wide guidance, that care workers should not feel the need to wear a mask for somebody who wasn't confirmed or suspected with the virus, unless they risk assess that they should. What we've done in the joint statement that I referred to earlier, which I would encourage everybody to read, it's been agreed with COSLA and the trade unions, is flip that on its head and say that every care worker should feel that they can wear a mask unless in their professional judgment they don't need to. So it is a much more precautionary based statement, and I hope builds confidence with care workers who are in the front line doing incredibly difficult jobs. Now that statement, which endorses the guidance but is very clear about that interpretation of it, has been agreed, as I say, with the Scottish Government, with COSLA and with the unions who all took part in a meeting yesterday. So I hope that resolves that issue, and of course we continue to focus on supply and distribution.
Richard Leonard.
Thanks, Presiding Officer. The other question I want to touch on is the question of testing. The World Health Organization continue to advise test, test, test. And the National Clinical Director told the BBC this morning in an interview that I think 5,000 health and care workers have been tested in Scotland. So my question to the First Minister is, how many health and care workers have requested to be tested? A breakdown between those 5,000 people, how many are care workers and how many are NHS workers? And what are the current rates of absenteeism in the National Health Service and in our care services?
The current absentee rate in the National Health Service related to the virus has been around 6%, and we continue to monitor that carefully. We are increasing the numbers of healthcare staff, and where appropriate, their family members, close contacts, on a day-to-day basis. The 5,000 figure we've given, we hope to update in the next couple of days, and I would expect it to be obviously higher than that. We are building testing capacity with every day that passes right now, and by the end of this month we'll have the capacity to do 3,500 tests per day. It's over 2,000 right now, and it will go higher than that, and that's simply within the NHS. We're also seeking to bring on stream academic and commercial testing capacity as well. Testing is really important. It's important now. It will become really important as we have an exit strategy, as a way of going back to a contained phase of this virus where you test and isolate and trace contacts. But I want to be very clear right now about the limitation of testing. The current diagnostic test we're using can tell whether somebody has the virus while they're symptomatic, and that's important. But what it doesn't do is tell somebody who is in the incubation period that they have the virus, nor does it tell people once they've recovered that they've had the virus. So there's quite narrow windows in which this test allows us to say whether a health worker or somebody else would be fit to return to work. Because they test negative one day, they may be in the incubation period, they may be positive, or they may show up positive the next day. So it's an important tool, and we will use it to the maximum capacity, but we've also got to understand the limitations of it, and therefore the importance of seeing, hopefully in the future, what's called the antibody testing, which will allow us to tell whether somebody has had the virus, assuming of course that it does confer an element of immunity.
Richard Leonard.
Thank you. The First Minister spoke about maximum testing, which I think is important, but I also want to raise the question of compassionate testing. And I want to ask the First Minister today if she will commit to look at the case for testing those people who have lost somebody through COVID-19 so that they are not grieving alone. Would she also consider the case of people who are receiving end-of-life treatment in our hospices or hospitals, who frankly do not want to die alone? Will you be prepared to agree to the testing of immediate family members of people in that situation? In the end, we talk a lot in this discussion about statistics, but it is about human beings. And I would ask the First Minister to look favourably at those compassionate grounds for extending testing.
First Minister.
Well, of course, I will look at that now. I will look at that very carefully. I would say two things, because I don't challenge the premise of the question about the importance of compassion in every aspect of our response to this. The first point I would make is simply that we need to make sure we are using our testing capacity in the best strategic way possible to help us beat the virus and have the best chance of doing that. The second point I would make, not to negate the fact I will look at the issue carefully, is that there is only an effectiveness in testing somebody when they are symptomatic. There is no point testing somebody before they're displaying symptoms, and there is no point testing people after they have displayed symptoms. So I come back to that relatively narrow window of opportunity, just to illustrate the point that while there might be many people who want to be tested to show that they don't have it or perhaps have had it, the current test is not capable of doing all of that. So we continue to use it where we think it is most appropriate and is helping us with the wider efforts against the virus. But of course, I will always look at suggestions that are made and happy to come back on that once there's an opportunity to do so.
Thank you. Question number 3, Patrick Harvey.
Thank you, Presiding Officer. Like everybody else, my first thoughts, and those of the Scottish Green Party, are with those who've lost a loved one, those who are currently affected by the virus, and those who are working to care for them across our health and social care services. But as well as wanting those people providing those services to be safe, people across Scotland are also concerned with the quality of care that their loved ones are getting. And as the First Minister is aware, one of the issues that's been raised with me and with other MSPs is the issuing of instructions not to resuscitate a patient in certain circumstances, known as DNR notices for short. Now, we are all conscious that in medical care, difficult decisions need to be made about the appropriate form of care for people if the worst does happen. But those decisions need to be taken in the context of respectful discussion with patients and their loved ones, and in a way that respects dignity and control that people expect to have in these circumstances. Does the First Minister recognise that at the moment that isn't always happening in all circumstances, and that some people have been concerned, at the perception at least, that DNR notices are being issued on a blanket basis and without the context of that respectful and calm discussion with individual patients and their relatives where appropriate?
First Minister.
Yes, I have heard those concerns from some people, and I do think there are some cases of professionals trying to do the right thing, but perhaps not in the best way, and there are discussions that will be taken forward between the medical professionals we have advising the government, like the Chief Medical Officer, and in this case GPs in particular. Coronavirus aside, we encourage health professionals to talk to individuals and patients about anticipatory care, about what all of us as individual human beings would want or not want if we were in the final stages of our lives. And these are important conversations. They should be held sensitively and properly, and they may ultimately come to the point of asking somebody whether they would or would not want to be resuscitated if they got to that point. But let me be very clear, nobody should receive a DNR form out of the blue without those sensitive discussions, and absolutely nobody should feel under any pressure to complete those. And I want to be absolutely emphatically clear about that. We must continue to give people the best care that is available for them and the care that they would think is right for them. Sometimes that means respecting people's wishes about not wanting continued medical intervention, but these conversations must be sensitively held and always respect people's wishes.
Patrick Harvey.
I'm grateful for that clarity. Can the First Minister give us an assurance that care homes, for example, and those medical professionals working with them will be reminded of the complete need to continue to respect, as we normally do, the requirement for that long-term and sensitive discussion with individuals? And can she give any advice to anyone out there who's concerned that their family member or loved one has not been treated in the way that they should in relation to these notices?
First Minister.
Well, my main piece of advice would be nobody should feel under pressure to sign something of that nature that they do not feel comfortable signing, or that they feel they haven't had the right advice. And people feel aggrieved that they've had letters like that, they can take that up through their health board, and we will take steps to disseminate that advice and information more widely to GPs and care homes as well. There's one other issue with care homes briefly, because it's been suggested to me that almost on a blanket basis, if people in care homes contract the virus, they will not be taken to hospital. And I want to be very clear, people should get the care that is right for them. And for anybody of any age, no matter where they're living, if that means being in hospital, that's where they should be. It will often be the case for an older person that the best and right place for them to be cared for is in their homely setting. But if they need to be in hospital, they should be in hospital, because the NHS is there to provide the appropriate and best quality care for everyone.
Thank you.
Thank you. Question number 4, Willie Rennie.
First Minister, I'll be out on my front doorstep this evening clapping for NHS workers, the social care workers, as well as other key workers as well. And I'm sure everybody else on this will be doing exactly the same. I also want to thank you for the work that you're doing to keep us safe. We know you've got many challenges, and I think I can speak for all of us that we're determined to help you overcome them. I'm concerned about the situation in care homes that you've just been talking about. Residents are vulnerable and the staff are essential, so we owe it to them all to get it right. Even though care homes are in lockdown, people are still being admitted. Some care homes are under considerable pressure to admit new residents from hospital without the necessary information to determine whether they are free from the virus. Ensure that the care homes get the information and support they need from the NHS to keep all of their residents safe. And secondly, if a care home resident catches the virus, the best place to treat them may still be in that home, but that should not mean that they are deprived of the right healthcare just like everyone else. Does the NHS have the capacity and the capability for primary and secondary care to be delivered in the homes to give people the best chance of recovery?
First Minister.
Thank you for your comments at the outset, and thank you for the question. Let me start at the end of that. Yes, the NHS is equipped to deal with this. The NHS is under incredible pressure, and it will be increasing pressure, but we've been reorganising how the NHS works in order to ensure that it can deal with the coronavirus challenge, and that is about caring for and treating patients when they need it and in the best way possible. In terms of care homes, it is appropriate for care homes to admit residents if that is appropriate and safe to do. The Care Inspectorate is working closely with care homes to make sure they have the right advice and the right support, and any issues or concerns are flagged up and can be addressed. What matters most is, of course, the infection control measures that are in place in care homes. At a very early stage of the epidemic, guidance was sent to care homes about how they should be caring for the residents. And unfortunately for a lot of residents in care homes right now, that is involving isolation in their own rooms and not having the communal activities that they will be used to. So this is really tough for them as well as for the population generally. So we are looking to the Care Inspectorate to have an ongoing supportive dialogue with care homes to help them manage through this crisis as well as they can.
Willie Rennie.
Thank you, First Minister. That's very helpful and clear answers. There are knock-on effects of this virus and the lockdown. On the one hand, people are finding new ways to connect to each other, helping each other in their community, and many are enthusiastically embracing their daily exercise. But I am concerned about the impact on people's mental health from isolation, and I'm concerned about the trauma that health and social care workers are being exposed to. We just can't wait until all of this is over before we start to address those issues. So can we put in place mental health counselling for all NHS and social care staff right now? Is that possible?
Okay, thank you. On a lighter note, I'm prepared to predict that you're embracing your physical exercise responsibilities better than the rest of us are right now. But it's a really important question because I've, from the outset of this, been acutely aware of the impact on people's mental health. Just the stresses of living through a situation like this, the changes to people's lives, not being able to see people that you're used to seeing, family members, grandkids, grandparents, but also the additional burdens and challenges and stresses that are on our frontline health and care workers. So we are mindful of this right now. A couple of weeks ago, I think it was, we announced additional funding to expand, for example, the NHS 24 phone and online services that people can access. We gave additional funding to expand the breathing space service. So we're already trying to build up the capacity of the services that are already there. But I want to give an assurance that this is something that is very high on our priority list, because not just in the immediate phase of dealing with this, but I suspect for a long time afterwards, we're going to be dealing with a mental health legacy of it. And we need to make sure that the services that provide the help that people need are there. And that, yes, is about expanding access to counselling now, but looking ahead to making sure that these services are appropriate in the future as well.
First Minister, can I say thank you very much indeed. In fact, can I say thank you to all our participants, all our party leaders this afternoon. We went slightly over time, but this is a serious matter. It deserves serious consideration. So thank you very much for participation. Thank you everybody else for watching. That closes this session.
Thank you.
Thank you.